I'm Paige, and today I will be discussing de-escalation techniques and ways to avoid escalation in mental health patients. This applies to all healthcare professionals, the support system, the patient, and any law enforcement that might be involved. Before we even enter the room, it's important to be trained in signs and symptoms of escalation and know your de-escalation techniques. According to Stubbs and Dickens in 2008, this includes observing for signs and symptoms of agitation, approaching the patient calmly, removing any triggers, and using verbal technique for communication. According to Dzubak in 2017, get to know yourself and how to handle the situation in a professional and appropriate manner. First, upon entering the room, you establish verbal contact by introducing yourself and giving them your title. Then orientate them to their place and ask what he or she prefers to be called, all in a polite and appropriate manner and displaying appropriate body language. This includes keeping your hands visible, staying calm, and having appropriate facial expressions. By keeping interactions to a minimum with how many people that they interact with while in your care would help to keep them calm. Ensure patient safety in the room for the patient, the staff, and yourself. Ensure that no weapons or potentially dangerous items are in the room, and you can protect yourself by keeping personal space between you and the patient. Berlin, FIshkind, Holloman, Zeller, and Wilson in 2012 said this is 2 arm lengths away. It's also important to make sure that you have a way out of the room, never get cornered, and also let the patient know that they are safe. If needed, a support system could stay with the patient, but if there's any tension or they aren't on good terms, it's a better idea to avoid it. When engaging in conversation with the patient, be sure to be concise and simple. Give them plenty of time to respond and repeat any questions if they ask. Active listening is important in the relationship, and you may find out information about the individual that can be helpful for his wants and his needs. Set limits with the patient, inform them what is considered acceptable behavior, have empathy towards them in a professional manner. Don't humiliate the patient, as that could be a trigger. As always, restraints are a last resort. According to Stubbs in 2008, avoid the use of IM medications if applicable. Offer the patient oral medications first, and then if it doesn't work, you could do the IM route. After an escalated situation's occurred, once the patient is calm, it's good to debrief with them. Also to debrief with your staff so that you are able to talk about ways to improve for the next situation. The rationale for these proposed strategies are effective quality patient care and positive patient outcomes. According to Power in 2010 on page 115, it states we must help them create a bridge from mental illnesses to a life in the community. The implementation timeline is immediately once the patient is in your care. Start with techniques to avoid escalation techniques, then if escalation occurs, use the de-escalation techniques. If de-escalation is effective, it will give the healthcare team an opportunity to give appropriate care to mental health patients. If the escalation occurs and the healthcare team fails, it's our way of using this as a learning experience to better ourselves for future occurrences. To evaluate this plan, we will see the patient outcomes. We can evaluate this by looking at the patient's recovery. According to Zeller, Schuster, Pancoe, and Resta in 2011, this is by looking at their self-esteem, empowerment, and social support, and ensuring them appropriate resources, education, support, and control. We can follow up with them in a week to see how patients are doing, ensure that they're taking their medications, see if there's any new lifestyle changes since they were last seen. Is there anything that the healthcare professionals can do to help the patient with positive outcomes and a quality of life? Also, we could look at readmission rates within a year. As healthcare professionals, we have to use these techniques and strategies to ensure patient outcomes that are positive. Thank you.